All right, looks like most of the people have logged in, so good morning. We'll begin now.
Good morning, everybody. My name is Darren Schwartz. I'm the Chief Planning and Strategy Officer with the Jewish Federation. On behalf of the Jewish Community Foundation, Lynch Foundation, and the Federation, we want to thank you so much for joining us today. It is absolutely surreal that we are doing a 6-month report on what's going on in our community and the ways that the emergency fund has been involved. First and foremost, for many of you that are on the call today, we could not have met the moment without you, and want to thank you so much for being with us along the way. In many respects, we've done some great things, and we know that there's still a tough road ahead. We really look forward to today, and I would like to now hand off the conversation to my colleague to the north, Executive Vice President of Lynch, Charlene Seidel.
Thank you, Darren. It's good to see everybody. And I say see, I'm using the, I guess, metaphorical see, because one thing that's taken some getting used to with these Zoom presentations is not feeling the energy of the people. But what I love to do is kind of look at the participant list. And as I did, as everybody's logging in, and as I did, I saw so many wonderful friends, some of whom it's been many years, some of whom I saw maybe pre-pandemic, and some of whom I've yet to meet. But it's, I think, really resonant of the theme that has really been, at least with me, and I know with so many of us, and certainly the people that you'll be hearing from today, the wonderful leaders, that we have a community that is here for us, and that we kind of, we're standing on their shoulders, or it's just an incredible feeling to feel all the support. And I really feel that when I'm looking at the wonderful names logging on. So really, really happy to welcome everybody to, as Darren said, a 6-month update on both the state of the San Diego Jewish community, 6 months into the pandemic, and also the outlook, the trends, the needs as we see them going forward, an update on the San Diego Jewish Community COVID-19 Fund, the emergency fund that many of you gave to so generously and has enabled so many community members to be helped. We have terrific guests to join us and sort of fill us in. They're on the front lines. They're the frontline responders. So I'm gonna really want to reserve the bulk of the program for them. But first, I just wanted to give a very, very short update on the fund and how some of the dollars have been used to meet what kinds of needs. And you may have seen the slide at the beginning, but the fund has raised about $2.3 million. We've given almost $2 million already of that. There's been almost 400 funders, donors to that fund, an amazing community effort, and 14 million plus and counting leverage from government. So I think I'm particularly proud of that, and I think we can all be, because one of the mantras of the fund is that it should be the first dollars in as well as the last dollars needed. And what I mean by that is that the first dollars before government could get a chance to respond, before the emergency needs. Where can somebody sleep that night? How can I avoid laying this person off in this moment? And the fund was able to step forward for that. And then the last dollars in that, how have we accessed and deployed all the other available resources? So the task force that kind of got started just a couple of days after this pandemic, or after the stay-at-home order was declared, the 3 organizations formed this fund. And I will say it's been a terrific partnership. We've partnered together, Jewish Community Foundation of San Diego, Jewish Federation of San Diego, Lynch Foundation, in order, frankly, to make it easier for our frontline responders, to make it so that they didn't have to fill out a lot of grant applications, check in with a lot of people about their needs. And it's really been, I think, a terrific partnership that I hope will also build other partnerships. And I think it already has. So that's been really good. And I think anybody that's been involved with that would affirm the nature of that partnership, as well as the efficiencies that have been accomplished. So I was thinking actually about the last time we updated you, and I think it was like just a few weeks into this pandemic, and it was in April, I think. I think it was even around Pesach, which is like a lifetime ago and like yesterday, right? So there's so much that we've learned. And I think 5 things stood out at me as I thought about it this morning, at least. Number one, how this pandemic has perpetuated inequities, how the existing inequities, economic, social, in our society have just become so much wider. I think in ways that it was not obvious, at least to me, around Pesach, how much those gaps would sustain in ways that we didn't see, like say in the recession, where maybe the market was more affected. Or I've been thinking a lot about the opening to the book A Tale of Two Cities, about the best of times and the worst of times, and the season of our joy and the season of our discontent. And that's kind of some of the ways that it seemed like. I think also reflecting in what we've really heard from those on the ground is that so many of those seeking help are seeking help for the first time, whether it be parents that need additional resources because the schools have closed, or somebody that their entire industry was maybe the restaurant industry and their employer went out of business, seeking help for the first time. Partnerships are so important now, and I already talked about that. I'm sure that our guests will as well. The non-linear nature of this. We have in some of our updates, as you've seen, we kind of set up different phases. So phase 1 was crisis response. Phase 2 was safe reopening, and phase 3 is adapting to a new normal. And actually there's a non-linear nature where we've been now going through all different kinds of, the phases go from 3 to 1 to 2 to, and it's been very adaptive in that way. And I didn't realize that. I think many of us didn't realize that at the beginning. And the final one that we all knew, but wow, was it affirmed, is our community has such resilient leadership. We can be so proud of the ways that our organizations have stepped up, the ways community members, volunteers, funders have stepped up, and you'll hear from some of that today. Very, very quickly, I also just want to outline some of the purposes and uses of the fund, of that almost $2 million that have already been deployed of the 2.3 million that was raised. And so there are 4 major areas: helping community members in crisis. So that ranges from everything from helping community members meet their basic needs, food, housing, medicine, to extended medical benefits for those Jewish community organizations that were, employees that were laid off from Jewish community organizations, bridge loans to organizations, domestic violence issues, funeral expenses. That's the first area. The second area is confronting a new reality. What next? What now? So those have been in the areas, the supports have been case management, employment support, maybe mental health counseling, parenting skills support, financial assistance for preschools, camps, and schools, or after school kinds of programs, job search support. That's confronting a new reality. The third area is safe work in community spaces. And so personal protective equipment, cleaning supplies, testing, all these new expenses related to COVID that many of the organizations and many of us as individuals could have never anticipated. And the fourth general area that the fund has supported is virtual and outdoor programming support. So as we've sort of gotten to know more about what we can do in terms of gathering, both gathering virtually online or gathering outdoors, we know that gathering is still such an important part of being in a community, that resisting isolation is so important for health. And so the fund has supported new technologies to make virtual gatherings possible, new resources, as well as some shade and tenting structure. So those 4 areas, those purposes and uses are just a quick summary of what the fund has been used for. We'll certainly talk a little bit more about some of the needs. There will certainly be other uses as other needs confront us, but let's get to our conversation now. And I'm so happy to introduce and welcome my colleagues, Pam Ferris, President and CEO of Seacrest Village Retirement Communities, Betzy Lynch, the President and CEO of the Lawrence Family JCC, and Michael Hopkins, President and CEO of Jewish Family Service of San Diego. And I was thinking about our guests, and it was interesting to me that we have all levels of experience or or veteranship in our community. So Betzy, I think you got here a couple years ago, a few years, it feels like forever, but okay, 3 years ago. Michael, I was thinking how long you've been here. I think 7 or 8 years. Did I get that right? Almost 10? 9. Okay, so and Pam, you've like me, and I hope you don't mind me saying this, you've kind of grown up in this community. Our professional career has been in this community, and we've really flourished here, I think, or you have. I won't speak for myself, but the community has supported us. So it's such a cool mix to look at this crisis. And I also just want to point out, and they are extremely young, but we have a combined century of work experience with the 3 of you, so makes us even more lucky. All right, so let's get to our conversation. The way it's going to work is I'm going to throw out a few questions and ask each person to sort of reflect as briefly as possible on the questions. And then, as Charlene said, please do feel free to put questions in the chat or in the Q&A area, and I'll be monitoring those. And then we'll also try to integrate questions into our conversation so we can ask them along the way. And then if there's some time, we'll also do some Q&A on the other side. So let's just talk about the first 30 to 45 days. This is, you know, the stay-at-home order was new. We didn't know how long. We didn't know what this is. What were 1 or 2 key needs and decisions that your organization or that you as leaders faced in the first 30 to 45 days? And what was different maybe about those needs in those first moments of the crisis and decisions than anything you had faced before? So I want to start with you, Michael, and then we'll move over to Pam and then Betzy.
Thanks, Charlene. Good morning. Good morning, all. You know, it's funny that you started with the combined length of service that we've all of us have been providing in the community. And I was actually thinking about just JFS. JFS has been around 102 years, and so in those 102 years, it's everything from World War I to II, to the Great Depression, to on and on and on, to wildfires, to unfortunately the shooting in Poway, to opening a migrant shelter. And so I think when in response to your question in terms of like what was different. In a lot of this recent situations where JFS has been involved, JFS staff and board, you know, like we're all fine and we're responding to a crisis in the community. Or sometimes we were impacted, particularly in the wildfires more than a decade ago. There were definitely staff and board members who were impacted. What made this crisis really different was that all of us were kind of in the midst of it at the same time, right? Schools were closed. We were dealing with staff who don't want to come to work, who do want to come to work. We're trying to figure out, you know, like how to operate remotely, but at the same time provide service. So I think that one of the you know, some of us share is that while a lot of businesses closed and had to close, we had to figure out rather quickly what part of our organization needed to stay open, not only needed to stay open, but actually needed to respond and increase. And so that was, I think the first challenge was, you know, like obviously our senior programs, our group settings, all of those, you know, literally vanished overnight. But around food, we recognized immediately that if older adults weren't going to be going to grocery stores and weren't going to be getting out, that we had to figure out how to ramp up food and get more meals out. And I have to tell you, you know, part of my role was just kind of like stepping back. Staff on their own figured, we had a shift in our kitchen from 6 a.m. to 2 p.m. Staff immediately figured out that we could have a second shift. We could double the number of meals. Rather than, you know, distributing food through a corner market, we realized that we could distribute food in our parking lot. And so I would say that in the beginning, it was really how we could ramp up, but also how we could ramp up in a sustainable way. We wanted to make sure that even though we wanted to do everything quickly, we also knew that if somebody called us and somebody said, I need a home delivered meal, that we needed to provide that. We did not want to say, oh, we'll get back to you in 5 days, or we'll get back to you, you know, that meal will get delivered in a week from now. And so the challenge was kind of pacing our ability to ramp and be dependable to our community.
Thank you. Pam? Oh, you're on mute, Pam. Wouldn't be a Zoom call without that.
You're right. Okay. Good morning, everyone. I wish I could say that it was just 1 or 2 things that we had to deal with in our organization, but it was a lot. And in the beginning, the first thing we knew, obviously, was that we had to keep our residents safe. And at any cost, we just didn't want COVID to come in these doors because we knew that it could spread, and we just were very, very nervous about it. But we also recognized that in order to keep the COVID out, it would probably most likely be coming in from staff who were going in and out. So we began what we called the Seacrest Pledge to try to educate the staff about the importance of wearing masks when you're not at work, not going out in public places when you don't have to, and washing your hands and doing all the things that we know do work. But we called it the Seacrest Pledge. So we instituted that. We started testing, not testing, but checking staff when they came to work. They had to wear masks and get their temperatures checked. And we encouraged them, of course, to go home if they were sick and go to their doctor and not come to work if they were sick, which we've always said, but we've stressed that more and more. A communications plan. We had to figure out who we were going to communicate with when we had information to share. And we did that with the full intention of always being very transparent. And we're very lucky we have a closed circuit TV program here at Seacrest. So we were able to share information that way and start doing our programming on that. We have a voice friend, which is something that's been very, very handy that we have. It's an ability to talk with families, text with staff and residents in real time. I think one of the biggest decisions we made was to not allow families to come and visit and to stop our volunteer program. That was huge, and it hurt, and it still hurts because they're still not coming back in. And that was a real big hardship, and has been for our community. And the last thing we did was decided we wanted to feed the staff. When they were here, we saw them coming and going and working extra and didn't quite know what was happening with all of their own family members, and we didn't want them to have to worry. So we started feeding the staff on all the shifts. So that's pretty much what we did in the beginning. And
Okay,
I'll stop right there.
thanks, Pam. Betzy? You're still mute. Oh, there you are.
Sorry, just took me a second. Good morning, everyone, and thank you to Charlene and Beth and Darren for inviting me to be a part of this panel. The JCC was I would say, in a very different position than both JFS and Seacrest, to the extent that probably one of the things that I would have called our biggest strength leading up to the moments pre-COVID was that I call the JCC a social entrepreneurship. And what I mean by that is more than 75% of our income comes from fee-for-service and the way people use our facility. And in that sense, how we would respond to this ensuing crisis and then the longevity of it as we stand in it now is much in the way that a for-profit business would have to navigate this. The benefit that we have is that other percentage of contributed income means we have a pool of people that care very, very deeply about the functions and the services and the gathering and the community building that the JCC does, that we knew that we were going to need to lean on in this moment. So the first probably, I'd say 30 to 45 days, we're connecting to a small group of people that would advise us, which is our COVID task force, who came not only from our board leadership, but beyond our board leadership to provide us with the guidance that we would need in our decision making. And the second piece we had to really think out, there were certainly parts of our business, even after the stay-at-home order went into place, that we could have continued. And then we had some ethical questions, which was about should. What should we be doing? And so we spent probably the first 30 to 45 days navigating that, not to mention the fact that we had over 300 employees here at the JCC, that in many cases, the thing that they would be doing, probably we wouldn't be able to re-enter into for a very long time, and we knew that 30 to 45 days in. I don't think we ever had imagined that we still wouldn't be doing it now, but that's the truth. And so my initial reaction to our team and our full transparency to them was, You now work for the Lawrence Family Jewish Community Center at the Jacobs Family Campus. Forget about your job title, forget about what it was specifically that we hired you to do. And there are going to be things that we're going to ask you to do that are outside of the realm of the things that you normally do, but you totally have within you to make it happen. And that allowed us to get programs up virtually. It allowed us to reach out to every single member, every single donor, every single user of the JCC to make personal contact with them and continue to build community in completely different ways. And that's what this first 30 to 45 days were about.
Michael, starting with Michael, and then again, sort of to each of you, as I guess the initial shock, we kind of knew that it wasn't just going to be for a couple weeks that we were going to be all, displaced, and as Memorial Day approached, and I'm curious, like how then you started maybe planning more midterm, and what needs and decisions, new needs that maybe came up as summer approached. Michael, I'm particularly curious for your answer to address the impact of the government support to individuals and families, the $600 extra a week, and sort of how you saw needs present in the context of those additional supports that, as I understood it, at least were keeping many families afloat. And then for each of you to also think about in your answers, any kind of new partnerships that might have emerged during that time, or ways that maybe you started to think differently or creatively even, as the pandemic and as the impact of the at-home orders became more of I don't want to at least call it a new normal, but just something that we knew would be around for a little longer than we thought after we recovered from the initial shock. So I'll start with Michael. That was a long question, and then go to Betzy and then Pam.
Charlene, you're right. Like in the beginning, I don't think that, I remember one weekend actually literally picking up my computer and coming home and putting it in my living room and thinking that it was just going to be for a little bit of time. And then, eventually we'll get back to the office. And obviously as May rolled on, it was clear that we weren't going anywhere, that, we were going to be here all summer. I don't think anyone realized that we'd still be here, at this point. And so initially, I think we were just trying to, hold down the fort and continue with what we thought could continue. By May or so, it was really clear that we had to redeploy staff, that, we had 40 to 50 staff who were employed to work in a migrant shelter. The border was closed. There weren't going to be any asylum seekers. We have to figure out the highest and best use of those staff members. There were staff in a variety of programs that those programs just didn't exist any longer. And so how could they be of service? And that's where I would say that you talked about partnerships, and that's where partnerships with the city, the county, and the state really came in handy. The county reached out to us and said, we have thousands of older adults within San Diego who need meals. Can you increase your meal program? And so that was one way we took staff who, as Betzy said, who, worked in the office or answered the phone. And, they were then in the kitchen, and, we didn't actually know they knew how to cook, and they were actually pretty good in doing those things. We had other staff, many of you know that we provided emergency assistance to undocumented. Over $5 million was distributed here in San Diego County and Imperial County, and we actually used the bilingual staff in our shelter to do that piece of work. I would say that one of the big changes that happened during this period was, in the beginning, we were waiting for literally the federal government, the state, the county, the city. It was phase one, it was phase two. It was like we were trying to figure out what was happening in the world, and then we were going to make our decisions accordingly. I think at some point in this period, we realized that we had to think about what were our values as an organization, what was guiding our thinking, and then we knew what to do. And so, for example, the value that we held was the one of self-determination. It's self-determination for the folks we serve, but it's also self-determination for our staff. Our staff had to decide one by one, did they want to go back in? Did they not want to go back in? Could they balance the needs of their children or caring for their parents and at the same time doing their work? And so rather than kind of getting caught up in this, whether we're opening or closing, what phase we're in, it was really like how do we meet the needs of our employees who are doing amazing work, and how do we at the same time meet the needs of our community? And I think that value, along with just kind of embracing flexibility and embracing that This was kind of, a period of time that none of us had experienced before, and just being okay with it, being okay with the uncertainty of it, helped us get through it. I think the other thing that just related to that is that we recognized that the fewer people who came to work was the better, right? So we have staff in our safe parking lots, we have staff in our kitchen, we have staff distributing meals. The last thing we wanted was more employees coming to the campus who didn't need to be there. We view those services as critical, and we only wanted those staff who absolutely needed to be on site to be on site. And that's why those of us who don't need to be there are not there, because we're still in that situation today.
Do you mind just talking for a minute? I think one of the things that was really striking about Jewish Family Service and other social services organizations that I spoke to was that you didn't get also though the immediate like floodgates of sort of, we need food, we need shelter, like the basic needs because of those government supports, because of the extra unemployment. And maybe now the social service organizations are having some of that. Just in that time, was that something that you had staffed up for and then didn't end up needing as much, or how were you all thinking about that and preparing around that?
So we knew that actually financial assistance would be critical. And there's a bit of a lag time. I think that at first, not that many families have a lot of savings, but they have some savings. And so in the very beginning, it seemed like food, particularly for older adults, getting, because they were not getting out, was the highest priority. And then what's happened lately is that we are seeing significant numbers of folks needing financial assistance, and mostly for rent. And so while everyone thinks that there's a moratorium on rent evictions, there's not a moratorium on paying rent, and that even in some of the new legislation here in the state, you're still responsible for 25% of your rent. And then you have families who just know that month after month, I'm not paying rent, and that anxiety of getting so far behind is unbearable. And so being able to help folks financially with some assistance toward their rent gives them a bit of peace of mind. And so that's where we're seeing the greatest need right now, are individuals who need help with rent, because they were employed in industries that are not back online. So while unemployment has dropped in San Diego, it's still, I could be off a little, but I think it's still around 12, 13%. And for many of those folks, they are in professions and careers and occupations that are just not open at this point. Mostly hospitality, leisure.
Thanks, Michael. Betzy, I know that May was a really critical month for the J in terms of some turning points. And so can you sort of rewind back to May and tell us a little bit about what you were doing then?
I'm going to go back a little bit. Go back to the beginning of May, because I think post-Passover was a really critical time for us. We spent, as I mentioned, in the first 30 to 45 days, we spent all of our time trying to connect with people and hear where they are. And what we learned really quickly is, while we were all in the same storm, we definitely were not all in the same boat. And different people were experiencing each their own. It was individualized and personalized in a way. This crisis, for each person, it felt different and their needs were different. And we were able to listen, compile those needs, and pay attention to, now we had to move from like, what should we be doing, to what do we have to do? And we then took the advice of our task force in combination with guidance from the CDC, as well as guidance from community care licensing, the local health authorities, and so on, to develop what would become the protocols that we would use to reopen the JCC. On May 26th, we reopened our preschool. And prior to that time, we began to think about, if we had the opportunity, this is the reference to Michael made to the phases of what was allowable. If you remember, at that time, they were slowly rolling into what would become allowable. And interestingly enough, childcare was something that was allowable the entire time, which is why we started with preschool. But we knew that if we were able to hold summer camp, that the confines of the JCC grounds would not be enough to accommodate the potential needs that parents would have for their children over the summer, particularly if they were expected to return to work. And so it really turned my focus and attention to where can I find our best partners? We knew that we were not going to be able to have transportation. For those of you that don't know, Camp JC in a normal summer houses about 750 to 800 children that come and experience Jewish summer camp at the J. And we do that by busing them from all areas of the county. And transportation is something that is completely, even to this day, and will continue to be for a long time, a high-risk activity under COVID. So transportation was gone, and we knew that those families would need camp too. So I started thinking about who are our most natural partners to bring Jewish summer camp to life. And we reached out to local synagogues throughout the county who time after time told us yes, said yes, they would be our partner, yes, they would help us. It ended up that we only, because of the needs of the community and because where people were in their own thresholds and because of the expectations of still being able to work remotely, one of those partnerships, and I do want to name out Bethel and Adat Shalom, who were totally ready for us and were ready for us to come, but it didn't end up that we needed them at that time. But Congregation Bethel and Gilad Hoffman specifically, and both rabbis at the synagogue have been our deepest partnership throughout this entire process. We held camp there this summer and very successfully, and it morphed, and we'll talk a little bit more what evolved and what came next during that time. But Bethel has been by our side thinking about the families in our community that needed our help to make sure that they didn't have to make difficult decisions about which partner would end up going back to work. And that has been huge in us helping and supporting families. In addition to that, and I hate to even say this out loud, but I think it's important to mention, right after camp started, we also reopened fitness, aquatics, and so on. And there was a roll in and then a roll out and a roll back in a little bit with all of it, but it's now functioning and has been. And we've been doing a ton of virtual programming, but we made it through the entire summer, which we started preschool on May 26th with 50 children. By the middle of June, we were up to 110 children in our preschool camp and 200 children every week for camp outside at Camp JC School Age Camp. And we made it through the entire summer with not one case of COVID-19. And the pride that I have in our staff is amazing, and we were able, because of the COVID funds, to make sure that we had the PPE that we needed to make sure that families that were coming to us for the first time for job losses had financial assistance needs that we could just say yes to without even having to think twice. And it was because of the fund that we felt the support of our community to do this for any family that needed it. And it was critical at that time.
Betsy, I remember you reflected at that time how, and it really made an impact when you said this, that you told your team, throw any previous rule books or protocols or manuals out the window. This is something that's really new. This is not camp like we've ever seen it before. And that was seemed to be such an important ingredient in your reopening and your whole philosophy.
Rabbi Weiser's on the call, and Rabbi Weiser came to observe camp and thinking about the preparation for what would eventually, when Soille goes back, and it's going back soon, and they came to observe what we were doing, and also the Del Mar Heights School District came to observe what we were doing, and other school systems came to observe what we were doing, sort of as setting an example of what would be best practice. And Rabbi Weiser looked at me and he said, how did you have the courage to do this? And it never occurred to me that it was courageous. What had occurred to me is it's just, we heard the families, we heard the kids, and what we saw was day one, everyone was a little bit of a ball of nerves. But on day two, the kids got out, even with their masks on, the sound of their laughter, it was just resonating. It was like music. And when you watched the parents take their mask off as they drove away, the relief that they felt for their kids to have some slice of something that was normal was so, so critical. And so I guess there was courage in the idea that our team would put themselves out there to do this, but we trained them and retrained them and trained them again to accept and understand what our new normal would be, and they exceeded every expectation.
Thanks, Betsy. And we'll hear from Rabbi Weiser a little later, which is exciting and wonderful. Pam, as you were thinking about the summer and maybe even some of the continued isolation or of your seniors, what were the one or two key needs that emerged?
Well, we weren't as lucky as Betzy, so congratulations on that, having a case of COVID. We have had a total of 17 here, only 6 residents, but the rest staff. And thankfully, the majority of them have been asymptomatic. But our first case was identified on April 29th. So we went for the first few months without any cases. So we were pleased about that. But that day, when we got that call that someone had tested positive, one of our staff, it was one of the worst days that you can imagine because it really threw us into this is real. And not what were we going to do, but how quickly could we do it? We had to focus on contact tracing, which was all very new to us. We had to come up with different protocols because we have, 4 different buildings here on the campus. We are working with the county, the state, the federal government, who are our partners and have guided us in many respects. But it just sort of rocked our world here. We also, in response to the residents, we recognized they were not in the dining room, they were having meals delivered to them, and we knew that they really needed to see their families. So we created a visiting program where our wonderful assistant building supervisor, Chris, designed these visiting stations, for lack of a better word, and they're on wheels and they've got plastic in between, and it's not ideal because we know that hugs go a long way, but it was the next best thing to being there, so to speak. And so we started this visiting program, and really from the very beginning, to deal with residents and their isolation, we always had compassionate visits. We always made sure that if somebody wasn't well, that their families could come in, or if the resident wasn't able to go outside, we put the PPE on them and let them be with their family. That was something that we knew as an organization. We already have that policy here that no one will die alone, and we weren't going to let that happen without our families being able to come. So we had that from the beginning. We started the Zoom program with our staff, and like you, Betzy, it doesn't matter what job you have, because right now it's going to be different. We didn't need our drivers to go out driving, so they became people that were doing other things in life enrichment. And it just seemed that we had to incorporate all kinds of flexibility, and the staff were amazing. And we saw leaders emerge that we've never seen before, and sometimes emergencies and crises do that. And that's what you want to see happen, because no one can do it all. But we have these Zoom programs, so we hired staff specifically to do Zoom programs with their parents, Zoom or FaceTime, and that was really successful. And then we had a lot of staff education, how to identify if somebody's really sort of falling, not in between the cracks, but just to be sure that they had the contact that they needed and what we could do for them. And we had to come up with all these protocols, again, of what happens if when a resident gets COVID, and then it's, is it first generation, were they actually really exposed, or was it their family member who exposed them and then they came and they might have been exposed? So we called it first generation, second generation, and we sort of came up with our own little playbook. But that really was kind of what happened in that next phase, and the need for us to just stay on top of it and to control it. And that was really hard. We had to keep staff out of different buildings, and that's not so easy when you have plenty of staff, but we have our core staff, our building services staff, our housekeeping staff, and they're not just assigned to one building. And so we had to sort of add more staff so that we could keep them in one building and contain, people not going from building to building. Because then if we had a situation, then it was contact tracing. And then like one time we had a hospice caregiver, and she exposed, 3 residents in 3 different buildings. And that just created a whole other what to do in there. But that's kind of where we were at that next little bit. Nothing changed from the first decision making that we had. It was more just adding to, because this became far more of a reality of how long it was going to go on. And, you know, I remember we were talking about the Seder and having to have, you know, Seders in the residents' rooms, if you can imagine, and certainly this in-house TV program helped. But now here we are with High Holy Days, and it's like, really? This is, you know, it. Anyway, I remember waking up on a Friday, and I said to somebody on our Zoom call, "How was your weekend?" And they said, "What do you mean? It's not, you know, it's Friday." And it just, you know, I think everybody knows one day is just, it blends into the next. But
yeah, and I think you hit on, thanks Pam, I think you hit on something really important that, like, I think all of you have reflected, and many, I think, people that are involved with organizations, is also just the ongoing nature, sort of sustaining, keeping staff morale up. Like, it's all very well, the first few weeks, everybody's adrenaline is flowing, Zoom is fun, you know, it's different. And then now, you know, in the month and after month, and each of you, I know, came up with really creative ways to do that. So I want to sort of move us forward and really to the big question, right? To look out 6 months, knowing you don't have a crystal ball, knowing the nonlinear nature of this, knowing that there's no end in sight, quote unquote. We don't have a, and where do you each see, either at your organization or maybe for the community, key needs? I limit your answer to just a couple of them. And the most profound areas and the areas you serve. We got a question in the Q&A about also just looking specifically as we're going into the fall and winter, knowing that the Spanish flu, that, you know, there could be like a second wave of the flu. And so that, I think, would be addressed in the next 6 months question. And I just want to, just before you answer, we'll start with Betzy. Just encourage, if any, you know, other people have questions, put them in the Q&A. We're just trying to integrate them into the questions and the conversation with our guests. So Betzy, why don't you start taking a look at the next 6 months, and then Pam and Michael.
It's really hard to think 6 months ahead since there's so much uncertainty, but I'll tell you sort of we scenario planned early on in this process, and we've built scenarios that we can roll into pretty easily, which just allows us to sort of pivot and think. I mean, you can't do what we're doing without some level of planning, but the depth of the planning can't be so significant because, to Michael's point, you can't wait 5 days to get somebody food that needs it. We can't wait a week and a half to try to get somebody into a program that we started called All Day with the J, that if a family needs help with their child with their distance learning because they have to return to work, we can't wait a week and a half to tell them if they have a spot or not. So there are things that we need to be able to respond to immediately. Quickly, we know that the needs of education, period, full stop, are going to be critical over the next 6 months. Right now, we have about 180 children that are currently doing an extension of our Camp JC program, which is called All Day with a J, which we're both running concurrently here at 4126 Executive Drive and at Beth to be able to meet the needs of as many families as we could, because now the kids have to be inside to do their distance learning. And then we're creating social emotional support, physical activity, and so on and so forth for them to be able to navigate what is a new version of school. We've formed significant partnerships, really functioning and thinking about educators specifically to meet the needs of teachers who have children at home, because it's impossible for you to be the best teacher that you need to be doing distance learning if you have your own children at home that are doing distance learning. And because of the support of the fund, we've been able to support so many Jewish people in the Jewish communal field that are returning to work to do their thing and need our help, as well as educators across the board that need our help to be able to do that too. I see that as an ongoing need. The program will morph as school reopens, and they'll be on campus on certain days and they'll be here certain days and whatever, and there's a whole structure by which we have to adapt and move and create new ways to be able to do all of that. This is the part that's interesting and powerful, and in some ways presented opportunity that does help build staff morale. Because it's sort of like, you know, it's not even like a Rubik's Cube, because, you know, that's sort of finite. This is like, we could do all of this, we just have to follow the rules, and how do we best meet the needs? This is what's kept our team going. almost all of the programming that we did in the arts and culture world. We've now developed a wonderful partnership with the Hive to be able to deliver that to our community at large, completely virtually, so that people that want and need arts and culture so desperately, because that's an industry that has been completely decimated by this field and will continue to be a huge problem moving forward for our entire community, is what arts organizations are going to be able to bounce back from this as this continues to go forward. The strength of the JCC is we're supported by a larger structure, so the San Diego Center for Jewish Culture, in our partnership with the Hive, can still deliver quality things in a virtual context, and as gathering is allowable in some version of itself, we'll be able to respond when that time comes. I also see in the future that mental health needs are such a critical piece. And while a lot of times the JCC's health and fitness and aquatics program sort of gets dismissed as an unimportant piece of what we do, and people sort of see it as a revenue driver, under this particular set of circumstances, there is nothing more important to provide some shred of normal life to people, to be able to get exercise in a way that feels comfortable and appropriate to them, and to feel supported in community in doing that, to help them overcome the potential anxiety and depression, because that is absolutely a prescription, meaning exercise is a prescription for both of those illnesses. And it's critical in this moment to give people access to that. I see that the needs to address what young families will encounter in having children home longitudinally. I see people that are now industries that aren't coming back at all, and additional financial needs that will come from that. I think one of the most critical pieces, and this is what I'll end with, that the community must be thinking about this, and I've said this repeatedly. As a female leader, when you're thinking about a family, inevitably, if there's a choice that a parent has to stay home for their child's education, more often than not, it is the female in the relationship that ends up staying home, which means women's place in the workforce will be significantly impacted the longer that school remains virtual, because women's inability to return to work in the way that they should be able to. And even if their kids at home and they're able to work remotely, being able to be the best version of yourself under those circumstances is nearly impossible. So we must think about how we're caring for the specific needs of women in the workforce under these circumstances as well.
So important, Betzy, such another example of how this is affecting all different kinds of groups differently. Pam, really briefly, as you look at the next 6 months, what needs do you see, key needs do you see, maybe one or two of them?
Yes, it's the need for testing of our staff and residents on a monthly basis. And we started doing the testing in July, so we've had 3 months of it. And we've identified people that have had COVID, so that have been asymptomatic, by our monthly testing. So we are doing a wonderful job of that, and it's expensive. We had to find a company that would work with us. Some of our residents are getting their tests and staff through the county, but the rest of the campus is not. The residents are tested and the staff are tested. So we're spending on the staff alone about $30,000 to $35,000 a month on the testing of the staff and the residents. And then the PPE is quite expensive. We have a good amount, and thanks to the fund, we've been able to make sure that we have plenty of that. And we want to continue to feed the staff, because we know that that's really important. That program has even morphed, as you know, Charlene, with once a month, we actually send a meal home with the staff to share with their families. So those are our big priorities. And then reopening the dining room. I didn't mention this before, but we were in the middle of a $9 million construction project here that had to kind of go on hold a little bit, because we didn't want construction people on the campus initially. So we had to figure out how that was going to work. We are almost at the tail end of that. And so we have to work, and we are working on the reopening of our dining rooms, because our residents, we know they're safe here and they feel that they're safe. And in many respects, I think a retirement community is a wonderful place for people to be during this pandemic, because they're not having to maintain their homes or go shopping and deal with all of the ins and outs of maintaining a home, but they're lonely, and we're going to just continue to work on that. And so we want to continue to engage them in ways that will bring them out of their apartments, obviously, and into the community and back with their families. Testing.
Thanks, Pam. Thank you. Michael, taking a look at the next 6
Sure.
months briefly.
Yeah, sure. Like I've been looking at my little crystal ball, and we've all figured out the next 6 months and further. But ironically, in January, our board began a strategic planning process, and we literally, it was a Sunday, it was I think 6 days after the first case was diagnosed in Washington State, and we went throughout the process. Throughout the last 6 months, we've been doing strategic planning, and there were many times that we said, this is crazy. We need to stay focused on the here and now in the agency. But at the same time, we realized that there was probably no better time to plan. And two particular goals that have come out of the plan that are really guiding us now and into the future is our ability to be an early responder, to be that agency that when there is a crisis and when things change, that we just can literally, on a dime, be responsive. Our team over the weekend started making calls to folks in the Alpine area because we have a vulnerable client list. We knew of dozens of older adults in that area, folks who use services like transportation, home delivered meals. Those are signs that they don't drive, that they aren't going to be able to get out of a community rather quickly. So, just like over the weekend, I was amazed to hear about how our team was already responding and reaching out to 211 and to the Red Cross to see how we could be of service to the wildfire. So part of JFS is like, as situations change, our team is incredibly nimble and adaptable, and so that will continue to happen. One of the other goals that emerged out of our plan was our commitment to serving the Jewish community, and that's why many of the folks on this call are really critical. The dollars that you have raised have really been significant. We are right now in the process of launching what I would call a whole team that is focused on serving the Jewish community. These will be case managers that specialize in working with Jewish clients and understanding their needs, and really providing the types of services that our community would come to expect for those in our community. It'll be launching with a separate phone number, sort of like a Jewish community hotline. I actually have the number. It's 858-637 and 3018. You would expect it to end in 3018. But through that, we want to make sure that the resources, the funds that are available specifically to the Jewish community are able to be distributed to the Jewish community. And so there'll be a team doing that work. And so, Jewish Family Service is interesting in terms of that we have this commitment, and it's in our name, it's in our founders, it's in our donors, of serving the Jewish community and being responsive to the Jewish community, and at the same time, serving the whole community. And it's in that balance, and it's in leveraging the best of the work that we do that we're able to meet needs. I just want to end with you in the beginning talked about Charlene in the beginning how this wasn't like a linear, and what we're also seeing is folks who were fine for the first 2-3 months, 4 months, 5 months are no longer fine. Corporations today are deciding that they need to lay off staff. And so we are seeing folks that had resources that sustain them for the beginning, but now don't. And so we think that as Betzy mentioned, we're going to continue to see issues around unemployment, mental health, and that's where we know that we can help link folks in our community to those types of services. We can't provide them ourselves.
Thank you, Michael. So important. Betzy, you wanted to say one more thing, and then we're going to wrap the conversation part, and I'm going to turn it over to Beth and Rabbi Weiser.
Michael gave me a wonderful segue, so I appreciate it. I mean, I think one of the emergent needs that this particular group of people we deeply need to pay attention to is, what does Jewish community look like during this time? If the formal ways that we gather together, I mean, the virtual space will probably work in some ways for a period of time, but we're going to have to be creative and thoughtful in how we work together to maximize our ability to create greater Jewish community under these confines. And while, Michael fills a space of, and JFS fill a space of meeting the people in their most vulnerable states, I think it's also important to recognize that people's need for connection is critical, and that each of us have a role to play in making sure that they're connected, that everyone is connected in the Jewish community in ways that feels good to them.
Thank you so much, Betzy. Thank you, Pam, Betsy, Michael. You are extraordinary leaders. Our Jewish community is so fortunate. I could go on and on. So thank you so much. And I will now turn it over to wrap up the program to Beth and Rabbi Weiser. So thank you.
There we go. Thank you, Charlene, and thank you for the great partnership. And thank you to Darren, and a special call out to Michael Jesser, the CEO of the Federation, who many of you know is in the hospital. So we wish him Misha Be'erach, of course. Wow, you know, those of you who know me know that I am rarely speechless, but listening to Pam and Betsy and Michael, thank you so much, not just for sharing this with us so that we can really understand what these last 6 months have been for you, but really it is courageous, Betsy, and you have all been courageous, and all the work that you're doing is taking care of our Jewish community, literally from cradle to grave and everything in between. And we're honored to be able to support you in that work. And I know that my staff, my own family and my staff and family have all benefited from all three of these organizations. So thank you all so much. I do want to turn to thinking about going forward. You'll see that we've heard from three incredible leaders this morning, but 37 other organizations have received funds from the COVID Emergency Fund to do this kind of work. And Charlene did a great job, and I won't repeat everything she said, but you know, we were there for all of these organizations in crisis, making loans in the beginning so that you know, we had people who could not make payroll on Friday afternoon, and we were putting money electronically in their bank account on Friday morning because of the grants and the gifts that you made into the COVID Emergency Fund. And we're really grateful for that. And so we were able, in the moment, in that crisis, to respond. And as I think some of the, you know, all three and Charlene indicated, there are likely to be new crises as federal aid is declining and support for small businesses is very questionable. So while we think about crisis as being the beginning, crises are intermittently showing up here. We've also, as you know, been, you know, what we call confronting a new reality. Those needs are really deeply where we're at now. Mental health needs are increasing. Domestic violence is absolutely on the rise. The more that people are at home, the more that domestic violence erupts. As people, you know, as industries are decimated, not only do we have to help people find jobs, but we have to help people with retraining to find new jobs for whatever the new economy looks like. And I have to remind everyone that the highest form of tzedakah in Jewish tradition is to help people become self-sufficient so they don't need help anymore. And we're deeply involved in that going forward now. And as Pam said, the testing needs and the sanitization needs, the PPE needs, those are entirely unbudgeted expenses, and they are ongoing. And so, you know, some of the grants that the fund made were truly one-time expenses in the sense of streaming technology and tents and shading structures and some other workspace technology that were kind of one time to get us to where we could function in this time. And we don't expect those needs, those expenses to reoccur, but that's a relatively small portion of the funds that have been expended. It is overwhelmingly about helping people and families in financial need, in psychological need, and helping organizations to deliver, to have the capacity and the equipment they need to be able to function in this new reality and provide those services. We do know that it's so far in these 6 months, the COVID Emergency Fund aid has touched about 18,000 individuals in the Jewish community. Not all of those are unique individuals. Some people have been touched in multiple ways, but it is still a great reach. And as we've said already, we don't have a crystal ball. We don't know exactly how much we need to raise to to support the community, you know, as we continue through this time that we don't know, that has no end. But our estimate at the moment is that we believe we need something like $1.5 million for this next stage of supporting our Jewish community. As you know, we've raised a little over 2 million. Most of it has been deployed. Around 400 very generous people have supported the fund. If you are one of those 400, we are enormously grateful to you. If you can step up again or additionally, every dollar counts, and we ask you to go to jcfsandiego.org/COVID-19 and do that. And if you are on the call and you have not yet contributed to this fund, this is a time when we really are asking every member of the Jewish community who can support our community to do so, because there are lots of people who can't afford to support the community right now and really need it. So I will stop there, but I really ask you all to go to www.jcfsandiego.org/COVID-19. And before we hang up, we did get we just got a note from a parent whose 12-year-old son was a participant at camp this summer at the JCC. He was supposed to attend Camp Mountain High, but for obvious reasons, overnight camps had to cancel. And my son ended up at the JCC for camp, and I can't express how important it was for his social and emotional well-being. Everyone at the J was extraordinary, and I really would have been incredibly worried about him if this option had not been available. And I know, even in my own narrow circle, of several other people who would say that about Seacrest and about JFS and about many of the other 37 organizations. So before I turn it over to Rabbi Weiser to give us a final word as we enter the holidays, I wish you all a Shana Tova, and please make a contribution to the COVID Emergency Fund. We need it. Thank you.
Okay, and I'm here. We talked about touching the lives of 18,000 plus people. At this moment, there's 1,300 kids going to Jewish day school. And I'm here as a representative of those schools, of our Jewish educational system, to express tremendous appreciation to everyone who's donated, to everyone who's making this possible, and to really courageous leadership in the community. And I really appreciate Betzy mentioning the idea of courage. But I want to tell you, courage means making some decisions that have to be made. And what COVID-19 thrusts in front of us so significantly is that it's easy to let decisions slide for 1 week and 1 month and 1 year. It's easy to, under these circumstances, not be as tuned in to what it means to be a community or what it means to even help another person. And it's amazingly to the credit of our community that this Jewish Community COVID-19 Emergency Fund is in place. It has made and is making a remarkable difference in terms of physical health, in terms of emotional health, in terms of just the security in uncertain times of feeling as though you're part of something bigger. And that cannot be overstated. And I would just relate it to the beginning of this week's Torah reading. The Parsha begins on the very last day of Moshe's life. Moshe addresses the Jewish people and he says, Atem nitzavim hayam, you're gathered together today. Look around. Here we are as a Jewish people. It's hard to look around right now, although thankfully, and thanks to this fund, I can get up and walk through the halls and see 300 kids engaged in learning, preschool, through elementary school, through middle school, and you could visit the other Jewish schools and see the same thing going on, and that's remarkable in and of itself. And I would not have had the vision that that was possible if I hadn't stood next to Betzy during the early part of the summer and seeing those kids get out of those cars, have their temperatures taken, and safely and securely and happily and excitedly go to their cohorts and get together and be together as a community and see other kids and be part of something bigger than themselves. And I think that's where the real toll of this comes from. In terms of us as a community facing Rosh Hashanah, two thoughts. When are we going back to normal? That's the big question. Interestingly, the theme of Rosh Hashanah is that who says that that's such a great thing? Why can't we go on to something beyond, above, more deeply feeling as a community as we approach a new year? And COVID-19, with all of its terrible, tragic effects, has given us a chance to do that. You know, Michael spoke about the idea of reaching out to every JFS employee and say, it's time for self-determination, for you to figure out what you can do, what you can't do, what your circumstances dictate. Wow, how much is that in keeping with the idea of the Jewish people and each of us as individuals saying, a new year is coming. We're on the cusp of 5781. Let me determine for myself, what can I do under present conditions to build community more deeply and more strongly? How can we fight through these challenges of isolation and make sure that we emerge in a healthy way? And healthy means many, many things. For the Jewish people, it always includes a sense of connection to our fellow Jews. We're not a healthy Jewish people if we don't have a deepening connection to our fellow Jews. In some ways, it's harder to do that, but in some ways, just looking at the success of this fund, 1,300 kids in school right now in San Diego County getting a Jewish education, saying prayers in the morning, speaking Hebrew, learning Torah, getting a top-notch Jewish education and general studies education. It's remarkable that that can be achieved. And this is how you achieve it in this under these incredibly challenging times. So we like a world that has certainty to it. And we never have been able to apply that, to achieve that. No one can ever tell why a disease strikes one family and not another. Why a household, everyone can come down with COVID and be perfectly healthy 3 weeks later, and in another household, it has a decimating effect. So what do we do when we want a sense of security and we want a sense of strength? A, we realize we're part of a community and we care about one another. And for the Jewish people, that has always meant everything around globally, every Jewish person having a feeling and a sense of concern for others. And this fund gives us tremendous merit as we approach the new year. The fact that over 400 people got together, contributed over $2 million. More people are going to come on soon and do the same thing. And so in spite of our isolation, we're thinking about others, we're doing for others. And we can be certain as we approach the prayers of Rosh Hashanah and the high holidays, that that will be reciprocated from above. And perhaps this demonstration can really enable us to really stand together. You know, being at the JCC alongside Betzy, we both had our masks on. You know, we saw a community in action. This COVID-19 emergency fund has created a community in action. And I just want to confess something to myself, about myself to everyone. In early June, while I was so preoccupied with how to properly finish off the last school year remotely, knowing we would have graduation and kids would be moving on without seeing each other, I got an email from Sharon Goodson. And it said, Rabbi Weiser, let's start thinking about a safe reopening. Let's see what funding a school needs in order to achieve a safe reopening. And I have to tell you, I wasn't thinking about safe reopening at that time. I was thinking about managing a day-to-day situation, which seemed so fraught. And this is the kind of vision that we can have as a community. It made me stop and think, yeah, what would a safe reopening look like? Seeing Betzy outside greeting kids at the JCC gave me a clearer vision. And then knowing that there would be dollars available and allocated by the community to be able to modify an HVAC system and be able to redo classrooms so that they could accommodate 10 children instead of 20. All these things, it is courage, and it's shared courage, and it's one person's courage igniting another. And please God, we should see a new year of 5781 where we need less courage, but we'll have a big opportunity to figure out and emphasize self-determination. What more can each of us do to make our community better and make our community stronger? I want to wish a Shana Tova Umituka to everyone on this call and to the entire community.
Thank you so much, Rabbi. Thank you, friends, for being on here. Thank you for giving to the fund. Thank you for giving again or for the first time to the fund. And as we learn in our Torah, a community is too heavy to carry alone. And it means so much that so many of us are carrying it and making it lighter. So I think that's it for the program. I think, Charlene, are you